Look, I'm alive, the people walking, the people talking.
Hi, my name is Iman.
Hi, I'm Anuska, and we're about to interview Juan, who works for the International Drug Policy Consortium as the Campaigns and Communications Officer.
And we'll be putting in his introduction right here.
My name is Juan Fernandez Ochoa, and I wear many hats in this interview. One, most of them in relation to my work with IDPC, the International Drug Policy Consortium, which is an international network of 192 organizations from all over the world, 75 countries, who get together in order to advance drug policies that progress human rights and social justice. As part of my work at IDPC, I'm the campaigns and communications manager at IDPC. So my communications hat is about sharing the work of both the IDPC membership, the IDPC network, and the IDPC secretariat, but also maintaining communications within the network. As I said, 191 organizations, so there's a lot to discuss internally. So it has my communications role has those two sides. And then my other hat, which is the campaigns role, is about the Support Don't Punish campaign. So I am responsible for promoting, developing, supporting local partners of the Support Don't Punish campaign from IDPC.
Would you like to answer maybe why drug policy reform is important to you?
Yeah, I think there's two key aspects of why I think drug policy reform is important. One is about reducing the impact of and reducing in general violence and neglect, and this is not only by non-state actors but also by the state. So state violence looks like 1.2 million arrests and stop and searches in the UK, for example, over the last 10 years in relation to drug policing. It looks like people incarcerated for drug offences living in situations of incredible vulnerability and with little hope to live lives that are fulfilling and be part of their communities. So part of it is definitely about reducing violence and state violence, and part of it is about recognizing that drug policy currently is a vehicle for state neglect. So we know, for example, that people who inject drugs, just to give you one example, only 1 in 100 people who inject drugs around the world has access to even the most basic harm reduction services. We know that there's a crisis in access to pain medication when that medication is controlled opioids. So there are many ways in which the war on drugs potentiates and provides cover for state neglect and state violence. And when that violence isn't necessarily sort of expressed through the state, there are other ways in which current drug policy encourages the accumulation of power and resources in unaccountable hands that are also able to inflict and participate in violence in our communities. So we need to move away from the current situation in which we're in, which is incredibly, as I said, violent and neglectful, and move towards a space or a situation in which drug policy can create environments that are conducive to creating practices of care and support within the community. And I see these two as sort of two sides of the same coin. It is really hard to develop practices that are anchored in support, mutual aid and support when you have like state violence coming at you constantly. Because you're constantly trying to resist that violence and building a project of togetherness becomes, basically an obstacle course. So I think drug policy reform can help, particularly with the first part, like reducing the violence that we all experience in relation to the war on drugs.
Thank you.
Thank you. So how did you kind of come into working on drug policy reform, and when did you decide that this was something you wanted to do?
Yeah, it was an interesting journey. I, of course, was I'm Venezuelan, so I grew up in Venezuela. I left the country when I was 17, and I didn't think of that relationship between my involvement in drug policy reform and where I come from until I was at uni, very much like many in the Seeds project. And on my third year with some friends, we realized that many of us were from Latin American countries. We all sort of understood that the war on drugs had disproportionately negative effects and harmful effects on our communities and our societies, but we had never sort of approached this with any degree of depth and sophistication. So we created a little group of reflection where we set out to not only inform ourselves, but also inform like other students.
Thank you very much. So now, having been in the drug policy field for quite a long time, what do you think is a feasible policy in when it comes to like regulation and stuff here in the UK?
I think something that has become pretty how to say this, pretty clear, and I think it is really hard to find any authority or authoritative body that denies this, is that the criminalization of people who use drugs and other populations who are profiled to be involved as being involved in drug markets or actually involved in drug markets is entirely counterproductive. It only increases ill health, it breeds unsafety, it definitely doesn't contribute in any way to creating a society where people can thrive and where people can be well. And so I think ending criminalization as the core response in drug policy is not only one of the most important reforms that I can think of, but also one of the most sort of evidence-based and uncontestable in its positive impacts for the community. Now, the challenge becomes what is feasible in the UK. I think it's entirely feasible to decriminalize immediately in the UK. What's a little bit less clear as to which extent we're going to get that buy-in from the political class and parliamentarians and decision makers. And that's where I think the public and people who have the capacity to put pressure on decision-making bodies, either through elections or through getting involved in activism. There's so many ways in which we can put pressure on decision makers to make it clear that it is unacceptable that we rely on criminalization in this way, knowing what we know. I think, however, like something that is a big obstacle within the context of the UK, and I was mentioning this to a friend the other day, is this culture of punishment, this understanding that for whatever social ill or social challenge that we may be facing, believing that criminalization is sort of a one-stop shop to solve all problems and disappear all problems. We know that criminalization does exactly the opposite. It just exacerbates inequality, exclusion, alienation, precariousness.
And my opinions have completely changed in the year, and I've got such a strong stance now. But what would you like to say to someone that may not have like made up their mind about drug policy reforms?
I think at the heart of this endeavor, at the heart of drug policy reform, there is the idea of increasing the health and well-being of our communities. That is what we're all, and that's really difficult to oppose. Now, I don't think there's anyone that would look around and say what we're doing about drugs is right. Like I was mentioning, over the past 10 years, we have incarcerated, arrested, or stopped over 1 million people in this country. Scotland has the highest overdose death rate in the world. There's definitely something that needs to change. And I think I don't think people need to agree that they are necessarily you don't need to be a person who uses drugs in order to understand that life is precious and worth preserving. And so we need to think, how do we do that? Like, that should be our point of departure. What is causing harm? What is reducing the likelihood of our communities thriving and individuals being well? And how do we ensure that we tackle those challenges? Now, we have the prohibitionist response, which is, let's focus on criminalizing people who use drugs and anyone who's involved in drug markets. That has failed dramatically. And we have, like IDPC published recently a report taking stock of the implementation of recent commitments on drug policy over the last 5 years. And the numbers are just dramatic. Like, there's a death related to drug use, directly related to drug use, every 54 seconds. That is outrageous. And that doesn't include people who are dying because of police brutality. That doesn't include people who are disappeared in the war on drugs. That doesn't include a whole bunch of extrajudicial killings, for example, like we see in the Philippines. So this is an apparatus of violence that is a clear obstacle in ensuring the health and well-being of our communities. Let's have conversations that allow us to think, how do we preserve life, and how do we make our communities healthier and safer?
Thank you. I think that's it from me as well. Iman, do you have?
No, I just wanted to say thank you so much. Like you said, it's important to have these conversations, and I can't wait for us to continue talking about this in the future.
Definitely.
Yeah, I think it's definitely be very educational for us.
100%.
Good job.